Yes, we are.
Hello, everyone. My name is Maria. I'm the Medical Services Manager for Greenslopes Private Hospital. Thank you for joining us today. I've got Tom with me.
Hello, everyone. Yeah, Tom Coe. I'm the Medical Education Officer here at Greenslopes Hospital.
So welcome to our presentation regarding the internship program that Greenslopes Private Hospital can offer. We'll basically run through a few slides with you detailing a bit more information about what Greenslopes has got to offer, and also some details regarding the recruitment process. We'll give you an opportunity to ask us questions in the end. And we will also have one of our current interns, Ashley, coming to join us around 1:15, and she'll be able to participate in a bit of question and answer. It's good, at least there's someone who's literally an intern as we speak in the rotation here in Greenslopes. So Greenslopes Private Hospital, we are a 697 licensed bed tertiary teaching hospital. We have a non-trauma emergency center that's open 24 hours. We have specialty clinics. Our plastics team, we've got a very good outpatient clinic opportunity for that. Part of our specialty clinics, we also have rotations with regards to pre-admission for our pre-operative patients. We also have pediatric elective surgeries, very low risk, mostly tonsils and adenoids. We also have an 18-bedded ICU, which caters mostly to elective booked cases, surgical cases, although we get at least 20% of patients to ICU via emergency department, but mostly they're post-op that has been booked in electively for ICU. And for those who have had a MET or a code and require critical care, they end up in ICU. We have 29 beds in our coronary care unit, so that's CCU. We've got 3 cath labs. One of them is a hybrid one. It's very high tech. So for those of you who are doing placements here, I do hope you get a chance to see the theaters because they're very high tech. We've got 27 main theaters, and we do a lot of robotic surgery, the Da Vinci robotic surgery. We've got a lot of those involved in orthopedics and urology. We've got 26 maternity beds. We've got a nursery as well, a special care nursery, which is level 4, meaning very low risk. We've got 7 birthing suites. We also have our own radiation oncology and PET scan called ICON. And we take pride with our Cyril Gilbert, which is our day oncology unit. We have our own mental health unit, which is more of the Department of Veterans Affairs, meaning DVA. So there are war heroes or war widows who are admitted with low risk mental health issues, which could range from PTSD to anxiety and depression and a bit of eating disorder. But we mainly look after our veterans in that area. And we also have a 45-bedded rehabilitation unit, and we have a day rehab program as well. Now, we are the largest private teaching hospital in the whole of Australia. We have been training for over 25 years. The last 10 years to be exact. So from 2014, the Department of Health started providing support to private hospitals like us. So they have been partially funding us to help us train junior doctors. We have a very extensive training infrastructure. So for those of you who are students here, you would have been exposed to our simulation center, the tutorial rooms, which we're using right now. There is also an on-site library, and we have at least 3 conference facilities. And from 2014 to about now, 2024, we would have trained at least 600 junior doctors and we don't only train interns, We also train you up to your PGY2 as residents, PGY3, so from junior house officer, senior house officer, registrar, and into your advanced training until you're ready to become a consultant. So we train you from step 1 all the way up. We are accredited to provide training for all of the PGY levels, your postgraduate year 1, 2, and 3. We are also the only private hospital within Australia with a level 3 accreditation when it comes to basic physician training. So basic physician training is the pathway that you take if you want to end up becoming one of the general medicine physician or end up specializing as an endocrinologist, infectious diseases doctor, a rehab doctor, etc. Advanced training in surgery, medicine, emergency, intensive care, radiology, and psychiatry. So we have rotating to us very senior doctors, probably 1 or 2 years out into becoming a consultant. You will be working with them if you're one of the interns who would decide to come join us. So you will be exposed to a lot of other senior doctors that can provide supervision and support for you. We also have the University of Queensland Clinical School campus on site. As you're aware, we work closely with Karen on that. And we have the Gallipoli Medical Research Foundation, which is on site. And there's hundreds, and I'm not exaggerating, but hundreds of ongoing clinical trials that the Gallipoli is involved with. And that all happens here in their hub here in Greenslopes. I've already mentioned to you, because I was so excited, that since 2014, the Commonwealth has been funding partially our internship program, and we have been successfully training up to at least 600 already. With regards to the Commonwealth funding that internship program, we are part of what we call the JDTP. So if you write that down so you can Google further, but basically Junior Doctor Training Program. That's a Commonwealth funded program, and under that is a private hospital stream, PHS. When you click on the PHS portfolio, you will then be led into a better understanding of what the program is all about. So basically, we are funded partially by the government in order to provide support to us providing doctors in the private health setting and in the rural setting. So you get the best of both worlds when you join us and decide to be part of our internship training program. You get to work here in Greenslopes, which is a private hospital, and we get to send you to our networks with the Queensland Health and even the Northern Territory Health Group to do a term with them as part of your rural rotation. That's the goal of the JDTP program. They want to be able to provide us the facilities, both private and public, an opportunity for us to train doctors to be able to see the best of both worlds. I'll pass you on to Tom.
Thanks, Maria.
Thank you.
A little bit more about why Greenslopes Private Hospital is a good choice for a JMO. And actually, before I go through a little bit of that, I'll say if this can be a fairly organic presentation, so if you do have questions, please feel free to unmute yourself, excuse me, and ask. We can clarify things as we go. And we will have time for some questions and answers at the end, certainly as well. Certainly at the back end, once Ashley Ung, one of our interns this year, has spoken and hopefully answered a few other questions as well, but we will have time for more. So a little bit more about why Greenslopes Private Hospital is good or a suitable choice for a JMO. You can see it says a unique experience. What does that mean exactly? Well, ultimately, there's unique people here that provide that unique experience, and that first port of call would be your supervisors. So the supervisors that you will have are our consultants, the VMOs that are here. They're not remunerated by the hospital for those supervisory positions or anything like that. They do that. They take on these teaching positions and these supervisor positions because they are genuinely interested in mentoring and shaping the next group of junior doctors coming through. They're passionate about teaching, and they do undertake their own professional development and training to make sure that they're up to date with their own skill sets and the expectations outlined by the AMC and the PMAQ, our governing body, around what are the expectations around effective supervision of junior doctors, including teaching, assessment, reporting, well-being, and supporting trainees as well, all the way from day one to when they actually leave here as well. So the unique experience does start with your supervisors. And then the supervision culture here is very good. We have a very thorough orientation program for our registrars that come here as well. And in my role as a medical education officer, I do reach out and have a lot of contact with the registrars, who are also very much primary supervisors of the junior doctors, and make sure that there's a genuine collaboration between myself, medical services, and the rest of all the relevant people, to make sure that if you are here and you're training, that you're getting very good support, you're getting good supervision all the way through. When it says opportunities, the truth is we've got, as Maria has outlined previously as well, there's a lot of facilities and resources here at Greenslopes, whether it be, up at the simulation centre with a lot of our high fidelity sim equipment, or the ED, or many other resources on the wards. We've got the Gallipoli Medical Research Foundation as well. I guess what I'm trying to communicate is that the opportunities are actually very broad, and it's really what you want to make of it. There is a lot of flexibility and freedom when it comes to exploring your own learning here at the hospital as well. You'll rarely be told no if you're actually a keen and curious learner. So there are many opportunities available to you. It's supported in a sense that there's a very clear sense of what are the roles and expectations of the junior medical officers, and we work to make sure that you're crystal clear around what you're being asked to do day to day, but also your teams broadly are very much aware. The nursing staff, the NUMs, the allied health are all very much part of that support network for you as well. We've said small hospital feel. That's because despite having 700 odd beds here, we do have a pretty unique small feel. You'll get to know the medical services team, myself, very quickly. We know everyone here, by name very quickly as well, because there's a lot of FaceTime. We see you every week. In fact, I probably see the junior doctors every single day, just about, here at the hospital, and check in with them a lot. It does have a small hospital feel because the teams as well are quite collaborative and hardworking, and you will find your feet very quickly. Private model of care is that you'll work very closely with consultants. If you were working in a public hospital, for example, you'd probably have almost little to no FaceTime with the consultants. It'd probably be a resident doctor and a registrar that you spend a lot of your time with. The beauty of the private model here is that the patients are admitted under the consultant, and you are effectively executing and working through the management plan or the health plan for that particular patient under the guidance of that consultant. So there is a lot of direct contact and learning and collaboration with the VMOs here. Patients, here as well, like Marie has also indicated, we have a unique group of patients that come through, particularly with the hospital's history with mental health support with our veterans and things like that. So we do have a unique flavour of patients here as well, which is fantastic.
Sometimes as well, Tom, I think the common misconception is, private hospital, I'm not going to get as much experience learning from that because it will have limited exposure compared to a public hospital setting. But I, for one, can certainly reassure you that that's not the case. You will have plenty of opportunities and exposed to clinical scenarios that you would also be seeing in the public setting, or sometimes not, because if a patient has got private health, they end up coming to us with this very special, really rare immunology case, rheumatology case, cancer case. So it's very broad, and the opportunity is just quite wide for everyone to have a good learning experience with us.
Yeah, definitely. A lot of complex cases come through the door every day. So the learning here is quite robust, and the patients are definitely unique. In terms of the rural time, we've added this as well, and there's some further slides soon, but The rural experience is hugely beneficial to the junior doctors, and we have a number of different sites that our junior doctors travel to. We'll look at some pictures and I'll talk to them a little bit more later, but ultimately the rural time is, many junior doctors say, it sort of supercharges them, because you will go off to a public health facility in Queensland or the Northern Territory, and you will step up more into that role. At the hospital, there will be some more expectation for autonomy and for you to really try and work with, at times, less resources. And there's a real sort of a growth opportunity there for you as well. People come back from those rural placements always feeling like they've grown an extra foot, and it's purely because there's a challenge there for them to actually really I guess embrace that idea of being the doctor and doing more with sometimes less resources at times as well.
Yeah, the common theme of feedback really, Tom, is when they come back, they say, Maria, I got to be a doctor there. So it's like, oh, what were you here in Greenslopes then? But yeah, you know, like it's a very reassuring feedback though, because as Tom has said, you know, you grow when you're in that rural setting.
Yeah, so it's an opportunity as well. Now with education, I'll go to the next slide because I know that it will cover a few extra things. We do have formal protected teaching here for our junior doctors every week. So there's intern teaching every Wednesday at lunchtime, and that will delve into, it's a pretty broad spectrum curriculum, but we will cover topics that are really pertinent to a person in their intern year. So the first 10 to 20 weeks of the year will be front loaded with things like chest pain, shortness of breath, ECG interpretation, prescribing, even information around the Mental Health Act. It's providing you with, I guess, a refresher and an opportunity to revise really pertinent skills that are necessary for you to feel confident on the wards as well, and when you're also doing some of those after hours duty shifts, so that education is fresh in your mind. We make sure that, and my background is in education, we have really specific learning objectives that we want to hit on the head in each and all of those sessions. So it's not coming in and sitting down and having someone just sort of lecture you for 60 minutes and walking off. Typically the sessions that we do here, the formal protected sessions, are going to be about 30 minutes, but they're really targeted. We want them to be collaborative and give you an opportunity to actually ask questions and work with each other to actually investigate the topics properly as well and feel confident when you leave the room. The JMO education takes the same vein, that it is a very targeted education with very specific learning goals. The curriculum becomes a little bit more broad in that sense, and it's to capture people in that PGY 2, 3 and 4 mix. Still accessible to the interns as well, and it's actually a mandatory component of their training. But those are two staples of the education program every week. So you've got 2 hours really of protected teaching there. We also have the hospital-wide grand rounds every Thursday, and that's where effectively everyone is welcome, and we get a good attendance from across the entire group, where we'll have consultants, registrars, and all the junior doctors in between. And at times even allied health and nursing staff will come depending on the topic. It's medically and surgically flavoured grand rounds. We try and keep it sort of a nice liberal spread across all those areas and subspecialties as well. We also have department and unit specific meetings. There's a Division of Medicine meeting every Monday. So if you are on a medical rotation, you'll be part of those. They are more or less teaching sessions as well, which are very much driven by the consultants and the registrars. There is also ALS and skills training every week here at the hospital. If you're starting with us, we have a pretty prescriptive ALS and procedural skills curriculum that we will make sure that you are put through. And that's, again, to build up your confidence and skill set, so that those first couple of weeks and certainly the term of your training year are grounded in really important refreshers on those skills. So you'll do ALS training, things like NGT, IDC, IVC, IDC, I should say, among many other things. We do METs and codes, simulations, and multidisciplinary team sim as well. So you'll never be bored when it comes to the actual procedural skills and the simulation training. We make sure it's very clear and happening for you. I should also mention that there is a bespoke element to a lot of the education we do here, and that's probably this small hospital feel. I'd say every week I speak with at least 1 or 2 junior doctors around a gap that they feel they have and that they want to actually address. Someone spoke to me literally just late last week about wanting to have a little bit more of a refresher on their theatre preparation, sort of scrubbing and preparing to go in as they had an upcoming surgical rotation. And then the following day, they were pretty much going up to theatre with one of our clinical educators to actually have a one-on-one session to refresh. I can almost confidently say that doesn't occur in the public hospital setting. I have worked at some big public hospitals, including the Gold Coast, and that just doesn't happen. The beauty of Greenslopes is you can talk specifically to people like me, and I can organise very quick support for you around your education, particularly if you feel there are things that you need help with. And that could be a pharmacist if you want some help with your prescribing. I could pair you up with a registrar if you'd like some one-on-one work with your clinical documentation. But at the end of the day, it can be very personalised, the education and support that we provide to you. So that's a huge factor, I think, in working here at Greenslopes, that you actually are very much known and you will be supported specifically, not just broad, brush strokes to try and cover a curriculum. We will look at what you actually do require and work with you.
We also have Dr. Mai, who's one of our cardiologists, who provides once a month an hour of what we call clinical communication training. And he spends an hour with at least 4 to 5 junior doctors. And in a ward, they are then told to bring a patient case, and that patient is discussed from assessment to the diagnosis to the treatment and to the plan after or for discharge planning and that. So Dr. Mai has given his services for free, really, to assist junior doctors, because he's picked up that during after hours, when you do your shifts, or even during hours when you're talking from one team to another, and you're talking to your consultant, he wanted to provide you a platform and a very structured layout of how to communicate effectively and clearly and with confidence to your VMO. And that's what we pride about, because this is a VMO teaching our students directly, our interns and our junior doctors directly once a month with regards to clinical communication, and providing them that confidence to actually give Dr. So-and-so a call and say, I've seen your patient, I've admitted, this is my assessment, this is what I think is wrong with the patient, my plan of care is this, are you happy for me to proceed? So it's VMO led, but you will perform every assessment that you can do in order to present that case to that consultant, who will then advise you of how to manage it properly, or agree or disagree with your plan of care.
And just with the informal education, and this probably comes down to the opportunities as well, and it's day to day, but the ward rounds, there's always good learning there, particularly with your consultants and registrars. There'll be bedside teaching opportunities as well. And the small group work, that occurs all the time here at the hospital. Just even recently, I've worked with a couple of our junior doctors to establish an AMC2 study group. And we've got a few people that are plugging away at the moment, just sort of informally behind the scenes, working towards completing their AMC2. So again, there's definitely room in the day and scope in the afternoons to get together and do a little bit extra and work on some of those side projects that some of you might be also eyeing off as well. So we just wanted to give you some of the visuals now, because you probably had enough listening to my voice. I wanted you to just have a little glance at some of the stuff that we do here. Trade exhibit, for instance, we have this at the start of the year when we do our orientation week, and it's a bit of an opportunity for you to get to know the actual teams here at the hospital, the allied health groups, the referral groups here as well. So Hearts First and Queensland X-Ray, Sullivan Nicolaides, getting all things like your logons and setups all sorted early in the piece, day one, really, to make sure you're ready to go, and to understand the multidisciplinary approach to healthcare and how these other groups and particularly the allied health can provide support to actually your patients and actually seeing that they have a really positive health outcome, that they're not back here 2 or 3 days later, you know, having some longevity in their discharge as well. So the trade exhibits we do, there's the Grand Rounds education. The very happy robed up gentleman in the middle there on those 2 photos is Professor Chris Strakosch. He's an endocrinologist here. He's been chairing Grand Rounds since 1984 or 5, I believe. And it's a really enjoyable curriculum that's covered here every week. And it's something that I think most people really do get a lot out of. So that's definitely part of it. We have international guest speakers that do come to Grand Rounds as well. And we have certainly people that are authorities on their particular subjects and fields. We do have cutting edge research happening here at Greenslopes, and a number of we have obviously this UQ here as well, and a lot of research happening, and that's typically presented and previewed at Grand Rounds during also our research month in September, where you're also invited to obviously share anything that you might be developing as well, or researching or working with a consultant on.
Just to touch on those couple of photos there as well, Tom, that's our Lumify device, which is our vascular access device. So that gentleman there is Justin. He's one of our radiology advanced trainee registrars, and he's teaching the junior medical workforce and some of the nurses as well on how to use that ultrasound machine for an ultrasound guided cannula. So we've purchased that device late last year, beginning of this year, and we're training up the junior doctors to have the confidence in using that. So yeah.
Yeah, a lot happening. The high fidelity sim center and conference rooms. So we do have a lot of facilities available for teaching and for quiet study, whether it be individual or group. We do have a very good JMO lounge as well. Actually, I don't know if it's in the photos here, but trust me, it's a good JMO lounge, well kitted out, plenty of food for you as well in there all the time. The high fidelity sim center though, it's really got really good technology and cutting edge resources up there as well. And you'd be up there just about every second week, just about, in terms of your training. AMA conference and mock sims as well. Yeah, like I said, the mock sim is very important because it's the closest to the real thing without it being actually real, and it gives you a real proper saturation and a chance to actually work on some of your skill sets in a safe and supported sort of teaching environment.
So the mixture that we provide for that group is I would allocate 3 doctors, an intern, a resident, and a registrar to attend. I inform them the day before. They have no knowledge of what the scenario will be, and they attend, and then they'll have 3 nurses with them. So we are really looking at more how collaboratively we can communicate, because that's the reality of things. The nurse will talk to the doctor about the patient, and then the doctor will give instructions to the nurse. So under that environment of controlled pressure, we're hoping to achieve that they're able to communicate and save that patient. So half of the time the patient is coding, and the other half the patient is just like having a minor hypotensive episode, and that. But in either way, we are looking at how to collaborate that communication between the nurse, the midwife, and the other parts of the health team through a mock simulation.
So our usual rotations on offer. When we say usual, this is because at times, depending on service provision and the needs of the hospital, including the offsite hospitals, these can change, but this is typically what any of our JMOs will be doing at some point during the calendar year. So with Greenslopes, as you can see on the left there, we've got the emergency rotation. Gastro, we have a number of gen med rotations, geri-rehab, respiratory, hematology, nephrology, oncology. And then it sort of delves a little bit further into some of the surgical specialties there. We've got infectious disease, rounding out medical, but then gen surge, neuro, ortho, plastics, and urology.
So basically we've got everything apart from
Pediatrics.
pediatrics and obstetrics and gynecology, but it's saying that pediatrics and ONG is available when you go off-site in Kingaroy Hospital.
Yeah, and just with those off-site stints, you can see it's quite eclectic. We have doctors that go up far north onto the Cape to Thursday Island and Bamaga, and the beauty of those, and Cooktown as well, and Weipa. And the beauty of those rotations is that you actually see a very unique case presentation and patient mix. Certainly Aboriginal and Torres Strait Islander healthcare is far more predominant in those parts of Queensland, whereas so upwards of 95% of, say, the case presentations on Thursday Island and Bamaga are going to be that First Nations and Torres Strait Islander mix. And with that being up in the sort of the tropics, you'll see unique presentations, particularly around disease and viruses and things like that. And then coming down further in the list, you can see Alice Springs there. So we've got the Northern Territory rotation as well. And there's orthopedics, renal, surgical and emergency posts in there. Gundawindi and Kingaroy are very much sort of rural hospitals in the Queensland area. If you're not familiar, Gundawindi is about a 4-hour drive west of Brisbane. Kingaroy about a 2.5 to 3 hour drive sort of northwest of Brisbane. And again, you'll see a good mix of case presentations at these hospitals. They're well supported, they're well resourced in many respects as well, but there is this ability for you to grow into your role as a doctor at these hospitals as well and sort of supercharge your skill set and come back here feeling all the better for it. So those external sites are, very eclectic, but very worthy and worth doing.
So if you do choose to join us and we are able to offer you the internship training program for 2025, you will be allocated to any one of these 8 sites. It is a doctor-only accommodation. We provide and pay for your accommodation for the 10 weeks that you're there. We provide and pay for your transport. So if you're flying there, we pay for your flights going there and coming home after your 10 weeks. We also pay for the gym membership on the 10 weeks that you're there, and we pay for any Wi-Fi or telephone bills that you may have just in case the hospital does not provide a very good Wi-Fi connection for you. Even though you're off-site, we maintain complete oversight of your general training, but in saying that if you're in Kingaroy, your roster will be drafted by Kingaroy, and if there's any concerns or incidents that's happened, they will manage it and inform us accordingly. We as a team, part of my role as medical services manager is to ensure that I assess the rural sites where we send our junior doctors. So in the past 16 months, we've visited, I personally have visited Kingaroy, Cairns, Alice Springs, and Gundawindi. And Tom, with the other team members, have visited Bamaga, Thursday Island, and we are going to Cooktown this September. So we are visiting to make sure that that proper site assessment is completed as part of the accreditation expectations of us, and to make sure as well that where we're sending our doctors, I am fully aware of how good the support, the supervision, and the structure is in that hospital. So I can vouch myself that I have been there, and I know that they will take great care of the interns that we send across, and that the interns will actually develop very good learning opportunities when they're there. So one of the questions is psychiatry. So we can send you on to, there is the KPU, which is a Keith Pain unit. We can allocate you there for a rotation, and that's mostly the DVA patients who comes in with PTSD, so it's very low risk. Once they become a bit of a high risk with regards to clinical care, if they're a threat to themselves and that suicidal, we have to transfer them to the PA hospital. So basically inpatients, mostly PTSD in the 31-bedded unit, but they have a lot of comorbidity, general medical problems. So diabetes, hypertension, cellulitis, and all those things come into play. So yes, there is opportunity for psychiatry.
Lovely. I'll also add with the external sites as well. When you are offsite, it doesn't mean that you're like sort of forgotten about either. Obviously, we do check in with you quite regularly to make sure you're finding your feet. Every external site has their own directors of clinical training like we do, and they'll have their very dedicated education teams, typically with an MEO or someone working in a medical education officer or administrative role to keep the wheels turning. But the connection again doesn't necessarily cut off. Like we will still provide the Wednesday, Thursday, and Friday teaching via Zoom to everyone offsite as well. And that's just a matter of sort of locking into the Zoom on your phone or on desktops and things at your hospitals, and you can actually still be a part of our education. We can easily set those sorts of things up as well, and they continue to roll even if you are offsite for 10 weeks. So I'll just move on to the next slide. And please, yeah, feel free to use the chat. I'll check it again soon, but we're actually sort of coming towards the end of what we need to present. Then Dr. Ashley Ung will give you the intern perspective.
Mm-hmm.
So yeah, the usual site rotations, which we've already covered really, and we've organised a lot of your travel and things like that there. Now these are just some of the sites along the way. Top left picture, I believe, is Gundawindi. You might have guessed the one on the right there is with the red earth is definitely Alice Springs area, the Northern Territory. Same with the bottom right. The one on the left there where you can see the nice water, that's actually Thursday Island as well. So really beautiful parts of Australia and that you could potentially go to. And there is time to get out and see these areas as well and make sure that you're not just necessarily in the hospital all day. There's Gundawindi on our recent trip. Very thriving local community, plenty to do and see there as well. The hospital gets really great reviews from our junior doctors, and everyone seems to really enjoy their time.
The photo in the middle top, the one beside Tom, in the gray shirt, light gray shirt, is Dr. Jared Connors. He is the Director of Clinical Training for Greenslopes Private Hospital. He is a cardiologist by trade, and he's the one who will be helping us to look after you as interns when you join us in 2025. That's Dr. Connors.
Yep, and the other gentleman is Dr. Michael Rasson. He's the Director of Clinical Training in Gundawindi as well. And on the other photos, you can see some of our junior doctors that have already been out there this year, Alberto and Ashika, and some of the areas around Gundawindi. Nice cafes, nice restaurants and places to go. The Gundawindi sits around right on the border of Queensland. It's sort of divided by the McIntyre River, and beautiful area to sort of walk and jog in the afternoons. Really peaceful part of Queensland. People really enjoy their time there.
The two doctors who were there, Ashika and Alberto, shared that they really learned a lot with regards to how to take care of our First Nation patients, from as simple as a family who comes in with a child with, say, an exacerbation of eczema, and what is your discharge planning for that particular child? You would normally, when you're here, if you're here in Greenslopes, you'd be prescribing emollient washes and things like that, and have a bath please at least twice a day, and then wrap around with your cling film and things like that. In Gundawindi, when we take care of First Nation patients, we have to adjust the plan of care that we provide. Do they have a bath? Are they able to take a bath? Will they be able to afford that particular medication? So things like that, both Alberto and Ashika have shared that they've learned how to really be more culturally aware and medically aware of how to provide care for our First Nations. It was very humbling for both of them to say that. It's quite good to hear from them as well.
Thanks, Maria.
Hey, Ashley. Oh, there you are.
She's on screen and in the room too. So the rural sites, Kingaroy is another great rotation, and there's Ashley and Maria in getting out and about, seeing the sites around the
A different
area.
Maria, not me.
Different Maria. That is a South American Maria, I believe. Brazil.
Pretty
Brazil.
Maria.
No. And so both enjoyed getting out and seeing more around Kingaroy. The hospital actually has just been recently renovated in Kingaroy in the last about 18 months to 2 years. So a lot of new facilities and resources out there as well. It has the feel of a new hospital. They've the director of clinical training out in Kingaroy is Dr. Peter Stickler. He's very engaged and very supportive as well. And as you can imagine, he keeps the teaching team and the supervision out there quite strict. And I think in a moment, Ashley will be able to share a little bit more about some of her experiences so far at Greenslopes this year.
Let's just drop onto that.
Sure. Well, like that. So Alice
yeah.
Springs, another hospital. You can see some of our doctors have gotten out there to see the sites as well. And some of them make it out to Uluru, as you can expect, and really enjoy their time there. We do things at the hospital around mental health as well and well-being. We certainly try and celebrate and at least acknowledge key days as they come up, like Crazy Socks. The winner this year actually was Daltage, who was sporting some Donald Trump socks. We felt it was fitting that he win. This is pre-assassination attempt.
The hair was the winner.
The hair was out of control. And
Okay.
recruitment.
So now, I'll spend the next 5 minutes discussing the recruitment process. There is, as I've mentioned earlier, please, it's your responsibility. Take full responsibility and accountability to actually go to the Junior Doctor Training Program Private Hospital Stream website. The dates for the actual recruitment for 2025 have not been released as yet, but based on the previous years, I can tell you that approximately September 25 to October 11, the internship application for that JDTP will open, which means after October 14 to 25, we will be doing assessment of applicants and interviews around that time. And then by November 11 and 18, I will be offering the jobs. Now, the criteria for priority 1 and priority 2. Priority 1, you need to be a full fee-paying international medical doctor graduate here this year in 2024. You must have done your English test already, and you are eligible for your provisional registration. That's priority 1. Priority 2 will be if you fall outside of that criteria, and you only have passed if you're an international medical graduate outside of Australia and you have only completed your AMC 1, there is a preference that you would have completed AMC 1 and 2 outside of Australia, and then you will be eligible to be a priority 2. Can I just also make sure that for both priority 1 and 2, you cannot be an Australian citizen or permanent resident, and you cannot be a New Zealand citizen nor New Zealand permanent resident holder. So you need to be non-Australian, non-New Zealand citizenship holder, and you need to be an international graduate, full fee paying and graduating this year. When you do apply, when the application is open, can you please make sure that your reference list is accurate, the contact number is accurate, and it is ideally, we would prefer the VMO or the consultant you have worked with rather than a registrar or an SHO. I wouldn't really be very confident in saying that, yes, I will take that reference from the registrar. It is strongly suggested that it comes from a consultant. The interviews will be via Microsoft Teams. It will be with myself and our Deputy Director of Medical Services, who is Dr. Mark Dixon, and our DC, or the other doctor will be our DCT, Dr. Jared Connors. The offer process is very tight, which means if we've done your interview and you are successful, we will send you a link to say that you'll have to open and you'll have to say that you're accepting our offer within 24 hours. If I don't hear from you from 24 hours, I will go next to the next doctor or intern, applicant that is in line with your scoring, because we will be scoring your interviews. Why are we very specific with the tight time frame? Because if you can, as you can imagine, part of this whole recruitment and your application process is that you will need to have your visa and your APRA registration sorted. And it takes a good 4 to 8 or even 10, 12 weeks for APRA and the visa to be sorted. The visa that we would prefer will be the 485, which is your graduate visa. Of course, if there is a situation that you will require a TSS or a 482 sponsorship, then that prolongs the process further, but that is something that, of course, we can work around with you. And the other important thing there is because as you can see, we are completely off sync with the public, with the Commonwealth recruitment. They have your colleagues, your fellow students would have probably been already offered or told where they're going for 2025, because they would have done that around June, July in the public setting. So you can imagine that by this time, some of you might have already accepted by the time that I'm offering the interview or I'm offering you a job. Then you might have already accepted a job outside of Greenslopes as well. So you have to be very mindful of that, because it's a very quick turnaround. So you'll have to work around on that with us. So again, the dates approximately September 25 to October 11, internship application opens. October 14 to 25, we will be doing our interviews, and we will be offering jobs from November 11 to 18. The contract will be for a year. Pay and leave entitlements are in parity with Queensland Health. The Survey Monkey will be sent to you for you to give us your preference requests, and your 5 weeks block leave. There will be 47 weeks of work, and we will ensure and assist you in making sure that you meet all those core requirements within that 47 weeks. And the orientation will be in January 13, 2025. And that's the website that you all need to, if you want to take a screenshot or a photo of that one. I checked this before I came to the presentation today. The dates are still not out, so please do keep an eye, but that is just my approximation. But by September 25, they will open the internship application. I'll pass you on to, there's further information there, my email address, Tom's email address, which is the GMO Education. And all of those, if you could take a screenshot of that, because you need to really start looking into your registration, the AMC certificates, and your Department of Home Affairs, which is basically your visa and eligibility to work here after you graduate. We'll pass you on to Ashley. Well, can Ashley be seen there, or should we move?
Oh.
Hi everyone. My name is Ashley. I am an intern this year at Greenslopes Private Hospital, and currently I'm on my term 3 out of 5. So it's been really very rewarding actually. I've learned a lot of things that you might not have learned in medical school. So I was originally from Monash University in Melbourne, but as an international passport graduate, it was not so easy for me to get a local and maybe a bigger spot in a tertiary hospital. So that was one of my considerations, and also I quite liked the idea of trying a new state, and that's why I preferenced Queensland as my first choice. And it's been the best decision I've made for myself so far since attending medical school. So the private hospital stream on the JDTB website is very intuitive, I found. So, and if there are any concerns or any questions, even reaching out to them via email, or I think they have a phone number that can be really helpful. So don't feel nervous to be able to do that with them. Clarify early, clarify everything you'd like, so you know what you're getting yourself, like the process. And once you have submitted your application, which includes prioritizing your states, which hospitals, they make it pretty straightforward to, they'll do the work for you. So all you need to do is show up for your interview, and when the offers come, and Greenslopes was the first to provide the offers straight away, and faster than other states, and it was excellent. And I accepted it, and since then, I think the main things for myself as an international graduate, and even as a medical graduate in total, your prescriber number, your provider numbers, your ARPA registration, these are things that are within your control. You can do them before starting, and that would help everything. So when you start work, you feel confident that you have all the information you need to be able to, attend orientation, and knowing that you don't have to be waiting on things. And that actually, some people, students or, recent graduates might find that, okay, that makes maybe, me have an easier time to transition because then I have to wait on things. But actually, no, it's always best to be prepared when it comes to numbers like that. And they are very important. I just came from an intern teaching that Greenslopes had, which we have teachings on Wednesdays, Thursdays, and Fridays. So Wednesdays are intern teaching day, and today was particularly nice because first we had nice food. Justin, GYG had sponsored a lunch for us, and it was a little bit different. But it was a little bit. There are different medical insurance companies available. As a recent graduate, they actually make it complimentary for you, as a medical student. Avid, I'm part of, whichever ones. I was part of medical school, I just extended it into internship here, so that's not a problem. We are very blessed in that regard. And had a teaching about something important, and has legal implications, which is consent and the capacity when it comes to patient care. So you would notice that in the private hospital setting versus the public, there are differences in how the senior clinicians choose to practice their medicine. But as a junior doctor, as an intern, it is still within our scope to do the best with what's been shown to us, and also knowing that whatever the same principles that we had learned in medical school about being a safe doctor, making sure that you have always, you consult your seniors beforehand. All these principles still apply no matter which hospital you go to. And with that, you will learn a lot. The medical services team here are genuinely excellent at hearing you. And if there are certain perhaps suggestions or things that you'd like for your experience as an intern or a junior doctor, I would feel comfortable to raise it to them. And they do take the feedback, and there are implementations that are underway, which is excellent. So that kind of supportive two-way communication is something that I had hoped for my experience with my first, big employer, and it's been the case for me. So that's been really positive. So yes, I wish everyone of you the best of luck with, final years. With I understand there's prescribing exam, and there's all the final tidy up bits. But I had one of your peers actually spoke to me yesterday, and I reassured him that final year is a great year. It's nice to take a step back and realize, there'll be plenty of work to do when you really start and you get that paycheck in. So for now, it's like enjoying the experience, even the interview process. It's all really good learning and good teaching for everyone. So yes.
Thank you, Ashley. So we'll just, if you hang around, so we'll just go through some questions. Do you accept late start interns term to commencement? The answer is no. We do not generally take late start interns because we work in sync with the funding of the Department of Health. So the funding would run for 12 months, which means from the start of that training year, January, to January next year. So we do not usually accept late start interns. OSHNA is a priority too. OSHNA is a priority too. If graduating in 2024 from an Australian school. Yes, yes, because you did not graduate within that year. You will be you would be a priority too. And yes, you would then be having to take no, because you graduated, if you're an if you graduated here in 2020, if graduating in 2024 from an Australian school and applying in 2025 after that year. So does that mean that you are applying for 2026? If you're applying a year after you graduated, then you will be a priority too, but you won't have to do your AMC exam then, but you will be a priority too because you are not part of the priority one, which is graduating within that year that you're applying for. Advanced training as a reference, preferably not. I would strongly suggest that you get it from a consultant. It's just that consultant would be able to provide us a better understanding from their standard of how you have performed as a medical student with them. The English test. Regarding the English test, do you, oh, how do I expand this? This one? Regarding the English, thank you. Do you need, I don't know what if you did not need to take an English test coming from. So yeah, so the Medical Board of Australia website, please go on to that one. This requirement for the English test is with the medical board, not from Greenslopes. So I will need you to research further on what they expect of you if you are required to do the English test, what sort of proficiency test they will require from you. I don't want to give you the wrong information, so I'd rather send you direct to the source. And please tap into the Medical Board of Australia regarding the English test requirements. Would a US citizen UQ OSHNA graduate need to take the AMC and English exam? Yes. With the English exam, I will need you to check with the MBA. I think the English exam for US citizens is not applicable, but for the AMC, you will need to have AMC 1 and 2 completed to be considered as a priority 2. Our next year's changes to the intern process also impacting JDTP. If changes to the intern process you're referring to will be the new national framework with regards to training. Yes, we are going with that change because we're part of the accreditation, the PMAC, so we have to comply with the changes with regards to the new national framework, and we will be implementing that. Okay, so because you will be a graduate, you'll be graduating from medicine, it is preferable that you would have your 485 because as far as I know from July this year, it's changed to at least 4 July last year to 4 years or something. I'm not really sure, but there seems to be a better capacity with regards to your 485 now as a graduate visa. In saying that though, we as a facility would be able to support you with a TSS, which is the 482, if you do not have a 485 for the next coming year. Some of the students who come across to us as interns have got the 485 until after the year after, say they started in 2024 with us, their 485 finishes in 2025. Ashley.
Yes.
Just wanted to ask if you had to take.
So, Rishabh, I did take an English proficiency test. It was the IELTS. There's the TOEFL. I don't think that's what I should call it, but yes, between the two, I understand that the second one actually might be more popular to take because it's maybe more intuitive when it comes to studying for it. Whereas for the IELTS, there are certain components which do require intentional study just beforehand. So either one would be fine, and do one that fits your preference, whether it's online, in person, and as long as you get it done within the time frame to get your APRA registration. That's the most important.
What if you're an Australian citizen but an IMG?
Oh,
Yeah.
especially,
Yeah,
you know,
you will be a priority too. Yes, you will be a priority too. How many applications are received each year? It varies. So over the probably an average of 60 to 80 a year, and we have 34 spots that's funded, partially funded by the JDTP. So we can get up to 60 to 80 a year.
You're welcome.
Any other questions?
Another question. What's included in the salary sacrifice?
Salary sacrifice, big difference between Queensland Health and us. We do not, what's included in us, I'll just share that one. It sounds better that way. Novated lease cars, gym memberships, and we have the Ramsey reward, which is linked with a few of the main retail shops. But apart from that, that's it. Yes.
Yeah, I'm happy to. So just expanding on that, when I first joined as well, that was something I asked because in the public sector, you do have salary packaging that the hospital automatically hires, Maxia, for instance, which is a very popular one. They give you a Maxia card and you can tap it around everywhere to use your tax-free money. But for here, because you do have two main benefits. One is that you do have that Ramsey rewards that if you're diligent and you claim what you want to use and you plan your expenses diligently, you can save in a lot of ways that way. And I think the biggest good in terms of financially, this hospital it's easy to claim for overtime. Very much so, whereas compared to other hospitals, you might have to work a lot of extended hours, but you're not sure whether it's remunerated, but you will still have to do it. Here it's really, really straightforward. You don't have to put in patient UR numbers. You can just, write a short comment on what the reason was for your extended time, and that would almost all situations be reasonably, accepted, no problem. So so it equals out in the fact that I find this, being at Greenslopes actually the positives in that financial regard outweigh what your concerns might be. Yeah.
There's a question here about what are the repercussions of breaking out of the 1-year contract early. Well, I'll be very honest. It'll be quite concerning if you as an intern who's meant to complete your internship training program of 47 weeks will be breaking that, because it's really on you. The repercussion is directly going to impact on you and your training and your completion of your intern program. So I think that's the best answer I could give. Because it's you not being able to complete your 47 weeks of required training as an intern.
I would also add that the repercussions would also be that continuity of your learning and your training, and that if you are thinking, I'll go to another hospital to continue or finish this training, other hospitals can sometimes be a little bit cautious as to why people are leaving training halfway or two-thirds the way through, and may have a few extra questions for you around sort of your reliability or your commitment to what you're actually doing. So it's be very cautious as to breaking and leaving a training program halfway through, as it can be a little bit difficult sometimes to come back in.
Situations such as if you fall pregnant and that, so that's a different scenario. That's an entirely different scenario. Family situations and that, again, a different scenario, but in general, if it was, as Tom has explained, you wanting to leave here to start your training elsewhere, you have to be mindful that that hospital that you would potentially be applying for you to continue your training program will be having some questions surrounding why have you left halfway through your training. Well, that's the thing. You will need to have worked here for 12 months before you're allowed to claim for maternity leave within Greenslopes. Okay? So you need to have worked here 12 months. So technically, no one is eligible to claim maternity leave via Greenslopes. Because none of you would have worked the 12 months as yet if you are going to fall pregnant while you're in your internship program. Any other questions? Any other questions for Ashley? Do you have any other questions here in the room? Well, we hope that the presentation has given you some information on how to on what Greenslopes has got to offer you, and hopefully you'd consider us when the application opens for the JDTP in September. We would love to have you on board for next year. If you have any further questions, our emails are available. We've had it on screen earlier. Thank you too. There's the application. So that's the actual recruitment process, and I was not able to provide you with the actual dates because JDTP has not yet released the dates, but approximately September 25 to October 11, the internship application will open for JDTP. And then October 14 to 25, we will be doing the assessment and interviews. So in those 2 weeks, myself with one of the doctors, either the deputy director or the director of clinical training or the deputy director of medical services will be interviewing with me. And then by November 11 and 8 to 18, within those 7 days, we will be sending job offers. And if we don't hear from you within 24 hours, we go to the next one in line with regards to the grading system. No one has asked about the interview process. How hard is the interview? The interview will not be hard, right, Ashley?
It was a study.
It's not
study
hard.
point, but it was comfortable.
I didn't think it was hard, but because the aim of that interview is for us to find out why you've chosen to come to Greenslopes. What is your career pathway if you already have an understanding or a dream or a vision of what you want to become as a doctor. And then we will be giving you a clinical scenario, and it's all about patient safety. I don't expect you will be answering me with, high-tech terms and treatments. I just want to know that when you're on your first day and there's a patient that you've been asked to review, you would know how to safely assess, safely diagnose, safely provide initial treatment, or I would be confident that you would escalate that to your senior before you do anything. But I basically told you what I expect you to answer on the day. But that's the key to the interview. What we want to hear is that we are getting someone on board that will be safe, that will be sensible and at the same time, one that can work within the Greenslopes, the Ramsey Healthcare mantra, which is people caring for people. We want to know that you actually care and you're not coming here just because you've got no other choice. Okay? Because that's going to impact on your training.
Check the chat again. Okay, someone's added something.
How do I go?
Just minimize the power.
Oh,
So,
there we go. For our references, similar to Queensland Health application process. Yes, it is similar, but it will be sent out by my team. Our team will send it out. So make sure the name of the referees is accurate. They are aware that we are contacting them via email with a reference report to complete and that it is required to be completed within 24 hours because it's really, it will delay us in offering you the job, and we don't want to delay anything so that your APRA and your visa, if you require visa support sponsorship, we can get it processed by November so you can start on time in January. We offer a 1 whole week of orientation as well. It's a very, very structured orientation.
Yeah.
Yeah. All right, thank you, everyone. Hope to hear from you and see you as we go through the applications this September.
Thanks, everyone, and good luck with everything moving forward. We may hear from you soon.
Thank you.
Good luck.
Good luck.
Thanks, guys. See you.
Thank you, everybody. That's it.